Dr. Jaffe, if someone has high copper levels, can they still take the Hematin Anemia Guard that has copper in it? And will it help balance out their copper levels? Should they have zinc instead, or should they avoid the hematin? What are your recommendations?
Well, it's an intelligent question because it acknowledges that in regard to minerals, it is always a balance. And in regard to copper, the counterbalancing mineral is zinc. So yes, you do want to have enough zinc, and many people are zinc deficient. They can get it through lozenges. They can get it through any number of, they can get it through lozenges. They can get it through any number of quality sources, but it needs to be bioavailable zinc. And more importantly, if your copper is elevated, the chances are very high that A, you're in a pro-oxidative state, which means you lack antioxidants. Not only that, you're not only in a pro-oxidative state, that copper is not just doubly charged. Copper can be higher charged. It's analogous to iron. There's a healthy form of iron that's called ferrous. That means +2. It's +2 electrons, but +2. And then there's ferric iron, +3. Ferric iron accumulates in the body, causes hemosiderosis and hemochromatosis. The answer is to correct the ascorbate deficiency using a C cleanse, reduce the iron from ferric to ferrous, and now the body can regulate the iron through urine, sweat, and stool. Same thing is true for copper. There's cuprous, copper +2. And then there's cupric, which is copper +3, and sometimes more. So when you see a high copper, the first thing you think about is an antioxidant deficiency and an oxidative or pro-oxidative state. And you correct that using ascorbate, nature's fully buffered, fully reduced ascorbate, using the C cleanse, polyphenolics, and you get the magnesium in. And yes, it is intelligent to increase the zinc in diet and supplements to help displace the copper, but more importantly, to get the redox, the oxidation reduction potential set by ascorbate. The electrochemical potential is uniquely and only set by your ascorbate level. So when copper goes up, it's usually because you're in an oxidative state and you want to pay attention to antioxidants and to balancing out the copper with zinc. Now, there is one more piece. There's a carrier protein called ceruloplasmin. And analogous to iron, again, you can measure the ceruloplasmin. And there are a few people, very rare, but a few people, that actually lack ceruloplasmin. Therefore, the copper is not carried properly, and the copper can build up. It's called Wilson's syndrome. And the answer to that is D-penicillamine, along with garlic, ginger, onions, brassica sprouts, and eggs, GGOBE, along with ascorbate. You might want to pulse D-penicillamine twice a week. So high copper is not caused by an excess copper intake. It's an imbalance of copper metabolism due to an oxidative state in almost all cases, except for the few people who lack ceruloplasmin. And then you can call me because I did my PhD on D-penicillamine, and I'm happy to guide the therapy in that situation. And Professor Wilson from the United Kingdom, at one point, all of the people with ceruloplasmin deficiency were seen by him. And using penicillamine correctly, smartly, and safely, more safely, he carried pregnant women to term. He had nursing mothers. He dealt with the issue, and he improved the outcomes. So please contact us. There are some details. It's an interesting category. And when the minerals go up, it's often because of an imbalance in the electrochemistry that is addressable with ascorbate and related friends, so that the body can then regulate minerals in proper balance.